Hello friends, welcome to Smiling. Often I find a person with renal disease facing cardiac issues. Cardiac issues in renal patients are very much common, and often cardiologists prescribe them either angiography or angioplasty. But now the question arises, if a person is having renal involvement, his creatinine is high, his GFR is low. Now, whether he can do the angiography or not, because the dye that we're using are generally renotoxic. Okay, so let us understand a little bit about this problem and how to solve the problem. The basic mechanism in the dye, that is majority of the dye contain iodine, and the mechanism via which the dye does injury to the kidney is vasoconstriction. The dye induces severe vasoconstriction in the capillary level. As a result, there is a high chance of the kidney to land up into acute kidney injury. Okay, this is the mechanism via which the dye damages the kidney. Now, in case when we are doing the angiography, there are two types of machine. One is a static, and the second one is a rotational machine. Okay, in the rotational machine, this is the patient, and the angiography machine rotates all around the patient. What is the advantage of such machine is, the advantage is, if we have such machine, the amount of dye that we need to inject in the coronary artery is significantly reduced. In case of a fixed machine, we need to suppose if we need to apply around 75 ml of the dye, we can reduce the dye even to up to 5 ml in case of a rotational machine. So if you are a kidney patient and you need to undergo angiography, first primarily ask your cardiologist whether we are having fixed dye, or we are having a fixed machine, or there is a rotational machine available. Second point is prehydration. 90% of the case we are not doing prehydration. If you are a renal patient and need to go for angiography, and then I would suggest you to start drinking lot of water at least 48 hours prior to your angiography. You need to be in a well hydrated state. If you are in a well hydrated state, we can avoid the risk of AKI in CIN, that is contrast-induced nephropathy. The third point is, we need to infuse the patient with NS, that is infused with soda bicarb. That we are not doing basically actually, but this is how we can prevent a renal injury. We need to start NS along with soda bicarb, infused with soda bicarb, at least 8 hours prior from the angiography time. Okay, the next point is starting N-acetylcysteine. This have an effect. We have evidence that say N-acetylcysteine is effective. There is certain literature which says it is not effective, but majority of the literature says N-acetylcysteine has a protective effect. The last point is known as sequential compression of limb. In sequential compression of limb, we take sphygmomanometer. We tie the sphygmomanometer in all four limbs gradually, one after another, and we increase the pressure inside it so that we can occlude the blood supply to the limb for some time. When we do such step, we are actually reducing the blood supply to the limb, and we are inducing an inducible ischemia to the limb. As a result of this inducible ischemia, body starts secreting certain vasodilatory substance, cytokines, that dilate the vessels. And when such dilated cytokines and chemicals are released in the blood, it can quite significantly fight the contrast-induced vasoconstriction. So before going for an angiography, ask your doctor for a sequential compression of limb. As a result, the chance of your kidney to land up into acute kidney injury will be less, because both heart and kidney are necessary. Namaste.